2016 has been a strong year for proponents of bioidentical testosterone replacement therapy for patients with low T. Multiple studies have been released already this year which continue to improve the known safety profile of the hormone treatment, which has grown significantly in popularity since the turn of the century. Earlier research presented evidence that suggested that there may be risks associated with recombinant testosterone, especially in regard to prostate and cardiovascular health. As clinical trials grow larger and more well-controlled, however, these potential risks have been shown to be much less prevalent than previously hypothesized, and that these risks are usually associated with the misuse of testosterone. In fact, new research builds evidence for the prospect that testosterone could actually be a boon for heart health among those with low T. The latest research with regard to testosterone and cardiovascular health was recently released by the Intermountain Medical Center Heart Institute of Utah. This study followed older men for a number of years in order to assess how testosterone levels and testosterone therapy affected the health and mortality of the patients. What medical scientists discovered was that men with coronary artery disease experienced improved outcomes when provided bioidentical low T treatment along with current standard treatment. They experienced a lower incidence of heart attack, stroke, and premature death than patients that did not receive testosterone replacement. In fact, the results showed a huge advantage for patients that opted for or were selected for testosterone therapy. Men with coronary artery disease experienced life-threatening cardiovascular issues at a rate 80% higher when they were not treated with physician-prescribed testosterone. Dr. Brent Muehlstein, one of the heads of heart research at the Institute, claims that the research provides significant evidence that men with low T are not adversely affected by testosterone therapy in regard to stroke and heart attack. It was hypothesized that men at elevated risk for these cardiovascular events may be more sensitive to an increase in testosterone levels, but this does not appear to be the case. This study involved patients ranging from 58 to 78 years of age, all of which were diagnosed with major coronary artery disease. In all, 755 men were evaluated and treated in the study. The patients were divided into 3 divisions, all of which were treated with low T therapy via topical gel or intramuscular injection. Each group took a different dosage of the medication. Even after a single year, it was apparent that patients that took testosterone for hypogonadism had improved outcomes compared to the control group. After 12 months, 21 men on testosterone experienced a significant cardiovascular complication, whereas 64 of the control males experienced a major episode. Those taking a higher dose of testosterone fared slightly better than their counterparts taking a moderate dose of the low T treatment. Patients were evaluated again 3 years after the study began, and the results remained clear. Among men on long-term testosterone therapy, 60 patients experienced adverse events, whereas 125 patients that did not receive testosterone experienced a dangerous cardiovascular problem. After 3 years, the patients receiving high-dosage testosterone fared quite a bit better than their counterparts. 22 males on high levels of testosterone experienced a major cardiovascular episode, whereas 38 taking a moderate dose experienced the same issues. Dr. Muehlstein is cautious regarding the results of this testosterone study, in spite of the positive results. Based on the data collected and analyzed in this study, it appears that testosterone therapy can be highly beneficial to patients suffering from comorbid low T and coronary artery disease. He asserts that, though this data provides positive evidence with regard to testosterone's ameliorative impact on such patients, further study is needed in order to both corroborate the results of this study and design a clinical study that can provide clearer evidence with fewer potential confounding factors. This study is a continuation of earlier testosterone research conducted by the Intermountain Medical Heart Institute. Last year, the Institute conducted a similar large-scale study regarding recombinant testosterone therapy, only among patients that had never experienced cardiovascular issues related to heart disease. In this study, it was found that testosterone replacement was not correlated with an increase in stroke or heart attack risk when used for the treatment of low T. In early 2015, the Food and Drug Administration used earlier research as a justification to command that all testosterone therapy treatments display a clear warning that the medication is associated with an increase in cardiovascular risks. This led directly to new research in order to assess the real heart risks associated with testosterone replacement. This study is one of a number that have already been released this year, which appear to refute earlier evidence using more complete data sets and improved data collection techniques. The growing amount of data which supports the benefits of testosterone with regard to cardiovascular health will likely lead to a figurative change of heart by the FDA once data accumulates and further justifies a full battery of dedicated clinical research with regard to the subject of testosterone and the heart. This research into the safety profile of bioidentical testosterone comes during a period when testosterone therapy is being evaluated with regards to effectiveness in a variety of different ways. There is recent evidence that low-T treatment may contribute to a number of positive effects which related to health and wellness. Testosterone therapy has been correlated with improved psychological profile among patients. Older men taking testosterone also experience improved gait and walking speed on average. Combined with the well-known benefits of testosterone with regard to sexual health and potency, there is an increasingly growing upside to low-T therapy, combined with an apparent improved safety profile, which increases the likelihood that therapeutic testosterone will continue to become more recommended and less controversial as years pass and evidence grows. If you found this video informative, please press the like button and subscribe to the channel. Don't forget to hit the notification bell so you don't miss any of my new videos, and please click the link below in the description to learn more about testosterone replacement therapy.